This show is for informational purposes only and is not to be construed as legal advice. Always consult an attorney for legal advice. Views expressed by guests of the radio show are individual opinions and not endorsed by Maitri.
Hello everyone, welcome to the Maitri show Between Friends. In this show, we will be talking about different issues related to intimate partner violence, family violence and abuse, gender-based violence, and power dynamics in relationships. The goal of our show is to engage our community members in addressing and challenging those harmful social and cultural conditions, norms that make intimate partner violence, family violence and abuse, and other gender-based violence acceptable. We believe our show Between Friends will mobilize our community in ending victim blaming and preventing violence and abuse in partner and familial relationships. In each episode, we will be providing insights and resources that will not only help victims and survivors, but also educate our community members about these issues. These resources and that are available in the community so that they can help someone in need. Tune in every Saturday from 3 to 4 p.m. on Radio Zindagi to listen to the Maitri show Between Friends. You can also find all episodes of Maitri's Between Friends on our website, Maitri Bay Area Facebook page, and on SoundCloud. You can email your suggestions and feedback to us at maitri@maitri.org. Together, we can end domestic violence, intimate partner violence, and gender-based violence.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
Hello everyone, welcome to our show Between Friends, and at today's episode, I am your host Nandini Ray, and we will be discussing the effects of domestic violence or dating violence on children and teens. I'm so glad that today we have Dr. Tasneem Ismailji as our guest. Welcome, Tasneem.
Thank you so much, Nandini. I'm very pleased to be here. Hello, everybody.
Dr. Tasneem Ismailji is a pediatrician. She is a co-founder, current board member, past board chair, and past president of the Academy on Violence and Abuse, a non-profit organization that works to advance health education and research on the prevention, recognition, and treatment of the health effects of violence and abuse across the lifespan. Tasneem also serves on the medical committee of the Santa Clara Domestic Violence Council. Dr. Ismailji has conducted several trainings on health effects of violence and abuse for over the past 25 years. She was honored by Family Children Services of Silicon Valley for her work on domestic violence and by the Santa Clara Domestic Violence Council with the Champion of Peace Award. Tasneem, I'm so glad that you are here today to discuss this very important community issue. And sometimes we think that, domestic violence, intimate partner violence, everybody knows about it. But no, even if they know, they don't want to talk about it. And this is a devastating social problem. Sometimes people think this is someone's personal problem. I am happy. I don't have any problem in my life. So why should I even discuss domestic violence? But we must understand that it is a social problem and it is affecting all of us directly and indirectly. And especially children. I mean, when children, they are seeing domestic violence, abuse at their home. And I think that home should be the safest place for all children. And if they are seeing that, parents are abusive to each other, or one parent is controlling and abusive to another parent or children, that is devastating. And as a medical practitioner, you see this kind of, and as a researcher, you do work in this field. So I would like to know that, can you please discuss that what are the short-term and long-term effects of domestic violence or abuse on children when they see violence at home?
So Nandini, these are very good thoughts. And what I would like to say, then, in addition to it being a social problem, the reason why I've been devoting so much of my time and energy is because it is a health problem. It affects the health of all of us. And so it affects the health of the woman who's in an abusive situation. It affects the health of the person who's doing the abusing. And it dramatically affects the health of the children. So just imagine a newborn baby, just born. And if you were to take this newborn baby and there was shouting and there was screaming and there was hitting around this 1-day-old precious new life, what do you think the effect would be on this baby? This baby will start to cry, and it'll cry and cry, and you cannot console a baby even though it's brand new. That is the effect of abuse in a household. This is an effect. So we want the children, we want the babies to be in a household that is safe, that is stable, and that is nurturing. And children thrive in that. But what we are talking about is abuse. And this is the effect on abuse on the children's development, and how it is that if you take this newborn baby and the baby stays in a home in which there is, demeaning, there's humiliation, there's the woman is being degraded, is being hit, is being injured, and perhaps in the worst situations, the danger may be so high that the woman may actually be killed, and the children may be also killed. So this is a very, very serious health issue and a health problem.
So what are the short-term and long-term effect on children? I mean, if they're seeing something, probably do you think that they will forget within 2 years, and or they will start coping it and start normalizing the abuse, or it will have any impact on their brain and their well-being?
Oh, we know this studies show there is a huge impact on the brain and the neurodevelopment. So if you were to go to the Harvard site on developing children, you will see all of the studies and the evidence over there. So as you take this newborn baby living in this household, you will see that this baby will have development issues. The baby will not develop normally. It will have certain effects in which this baby will now be very hard to regulate emotionally. They will have anxiety. They will develop depression. As the child gets older, they will have conduct disorders, low self-esteem, attention difficulties, reduced problem-solving skills, and do poorly in school, have difficulty making friends. So these are all the domains of a normal childhood that are affected very seriously by the abuse.
I was reading an article where it was, one child, they were talking about a couple of children who are facing domestic violence, who have seen domestic violence very closely. They said that couple of children, when they don't get attention from their parents who are always in conflict, they seek out for attention to outsiders. Like when they go out, they seek attention from strangers, and in that case they can put themselves in dangerous situation, right? So anybody can take advantage if from those children. Don't you think so?
That is a good thought. So what happens is that the children really are not able to regulate themselves emotionally. So they really don't know who are the good guys and not such good guys. They are not able to tell that. So neurologically, they have been damaged and they're not able to make this differentiation. So they may go out, they may go out looking for friends outside, And they are not able to tell who are the people that have the best interests and who are the people that don't have the best interests. And so they will put themselves in danger that way.
And also, do you think that they learn to be abusive to others by seeing abuse, all the time, that they may think that, violence or, anger can be the solution of everything. I mean, if I want to get things done, I can be angry or I can be abusive. I can use force to get things done. And then they start bullying their friends or their classmates. Is it possible too?
Yes. So what we know is that when children are raised in a home in which there is abuse, they are much more likely to either be the abusers, that's generally for boys, or they're more likely to be abused, that's generally for girls. So what is happening is that most children, all of us as humans, learn from our parents. It's not just humans. If you take birds or animals, that's what they do. The parents teach the children or the babies, with a little bird or a little animal, on how it is that they are supposed to live. And the same thing is for humans. So the children are learning from the humans. And these parents are teaching them, well, this is the way you get things done in this life. If you are not happy with what's going on, you yell and you scream and you hit and you injure the other person. There is a dynamic in domestic abuse that I think everybody should know about. And that is one person is controlling the actions of the other. So this is where this happens. So one person is in control and the other person doesn't have much that they can do or say. This is very important dynamic to understand, because a lot of victim blaming goes on. So what happens is that people think, there's something wrong with the woman. There's something that she's not doing right. If she could do something and keep her husband happy, there would be no domestic abuse. This is a key concept to understand, that this is not how it happens. It happens because it's usually the male, it's usually the husband, who then uses control and abuse on the woman. And that's the person who we need as a society to hold accountable. That's the person that we as family and friends need to go and say, hey, what you are doing is not the best for your wife. It's not the best for your family. It's certainly not best for your children. This person, if they are listening, may indeed change their behavior, may indeed say, what you're saying, I have to think about it. But they might have been brought up in an abusive home, and so they don't know anything better. That's one thing. The other thing is that it's our society and our media. If you look around, we are constantly bombarded by messages in the media about violence, about control. Power and control is something that people want. Mm-hmm. They want it in their societies. They want it in their business. Who is that big CEO? He's powerful. He's controlling. People admire that. But when it comes to a family, it's absolutely the opposite. It's very, very harmful.
Here I want to make one point that yes, we all know as domestic violence advocates, those who are working in this field, that statistics wise, yes, mostly men are abusers, but it's also possible that men are abused by their female partners. And so if somebody is listening and if that person is a male and thinking that, they believe that all the time men are bad, men are doing abuse, so I shouldn't be even reaching out to anybody to get help, and they won't believe me. So I just want to point out that that is not the case. Anybody who is abused and who is suffering, they have every right to get help, seek out for help. And everyone has a right to have a safe and healthy intimate partner life or family life. And so whoever is abusing, whether it is male, female, they should be accountable. It's not victim's fault. Abuse cannot be victim's fault. And whoever is feeling suffering from domestic violence, intimate partner violence, there are resources out there. 5 agencies in Santa Clara County, they are providing free and confidential help. They should reach out to them, and they can know their rights and options. Maitri is one of them. Next Door Solutions, Community Solutions, and Aki, and another one is YWCA Silicon Valley. Of course, Maitri is there. Please call them to find out your rights and options. Dr.
I would like to make another
sure.
point, Nandini. You
Yes.
are absolutely correct. And I usually think about this as beyond a gender issue.
Yes.
Unfortunately, it seems to be the statistics show that it's more men than women. But if you look at the minority populations, if you look at gay, lesbian, bisexual, trans, or questioning, we see perhaps a little more domestic abuse in those relationships. So we know it's a little more than just a gender issue. Yes, women are they are also abusers sometimes, but most of the statistics show that it's predominantly the men. And so, reaching out to you, to Maitri, and to discuss these issues is very, very important. Doesn't matter if you are a man or a woman or questioning or gay or lesbian or trans. It's very important to reach out to you because you are the experts. You see this every day. You know you can help them.
And Tasneem, another thing I have seen in our community, that divorce is absolutely a stigma. No one wants to talk about divorce, and many community members think that it is better to stay in an abusive relationship rather than raising children alone as a single parent. And sometimes they think that they are staying in this relationship though they know it is harmful for them, but they think that it is good for their children. And sometimes it is possible that they are not realizing that children are noticing, children are observing abuse, and they are, as you said, it is a learned behavior. They are learning how to be abusive or how to suffer in silence. So what do you think that people, when they think that it is better to be in a broken relationship, broken home for children, but where the children are exposed to domestic violence, intimate partner violence, is this a right decision? What do you think as a doctor?
So one of the things that I as a doctor do, one of the first things when I identify a family that has domestic abuse, I do what is called a danger assessment. So in this danger assessment, this is a tool developed by Dr. Jackie Campbell. And what it shows is that there are many questions that I have the family go through, the woman go through. And that's the first thing that I identify to see how much danger this family and this woman may be in. And it's a safety issue. So we know using this instrument, if there are signs that a woman may be in very high danger, then I have to, as a doctor, do something immediately. And that may be in consultation with the woman. The woman also recognizes when she does a danger assessment that because there's a lot of denial in people. And if you do the danger assessment, you find the danger is very high, then you cannot wait. You have to do something to save the life of the children and of the woman. So this instrument is available at Maitri. Is Maitri doing the danger assessment?
Yes, we are doing that.
Right. So if there is a family, if there's a woman who is concerned about it, that's the first thing, is to do the danger assessment. I myself start over there. And if the danger assessment is positive, then we immediately reach out to Maitri to take the case and do something in an urgent fashion. If you take most of the other situations that you talked about, in which there is emotional abuse, maybe it's not to the level of a danger, but there is constant emotional abuse, physical abuse, financial abuse, sexual abuse, then we have to do something as a society. Then we have to do something as a physician, because it has profound health effects. And so at that point in time, we sit down and we do some education with the woman about what is domestic abuse. We talk about how it is the abuser who needs to be accountable. And we first, the most important thing we say is, this is not your fault. And the effect on the children, when we describe the effect on the children, and then the woman understands how serious this is, then many times she makes up her mind that she wants to do something about it.
Mm. So do you think that children who are seeing domestic violence can recover from witnessing or experiencing this abuse? I think you did a lot of work in ACE area, adverse childhood education, right?
Yes.
So can you talk about that ACE?
Right. So this is a very exciting time, because since this January 2020, the whole state of California is introducing, it's an option for primary healthcare doctors to do what is called ACE screening. So ACE stands for Adverse Childhood Experiences, and that is 10 categories of child maltreatment, child abuse, physical, emotional, sexual, 2 categories of child neglect and emotional and physical neglect, and then there are categories of household dysfunction. That includes domestic violence, substance abuse, if a parent is in jail, if there's separation, single parent, all of those categories show that when you see if there are 4 or more of these categories, then they are related to the 10 leading causes of death in the healthcare. So this is a very, very important thing, is that because it has such profound effects on really complicated health issues. You think about heart disease, you think about diabetes, asthma, cancer. These are the kind of conditions that are related to having adverse experiences in your life.
Oh God! Sometimes, like me, people like me, we don't have medical background or medical knowledge, and we may not understand that on a regular basis that this has this kind of adverse childhood experience can have enormous effect on someone's life. Lifelong effect, right?
It is lifelong. It is through your life course. And then if you think about it, we also know that if you have 6 or more of these abusive categories, then you actually lose 2 decades of your life. So you actually live less than if you did not have these.
Yeah, that's a very serious issue that we need to, community members, they need to know about. Like sometimes we are not getting enough information about this medical world, what the researches are happening, what kind of research are happening in that area. And it's always good to do this kind of show to let people know that adverse experience in your life can have enormous effect in your well-being or in your health, so that people understand and do something about it. And especially I don't know. Sometimes it's possible that parents are, when the domestic violence, they are involving in engaged in any kind of conflict, any kind of, whether it is physical abuse or other abuses, and they may sometimes forget that someone is watching, and they keep doing that abuse or that violent behavior, and without understanding that they are ruining someone's life, right?
Oh, yes.
Ruining their children's life.
They are, yes.
Yeah.
And the children, they don't have, so some parents will tell me, no, the children don't know. When we have these arguments or when there is hitting, the children don't know because they are in a different room. I can tell you the research shows the children know. So we call this children exposed to domestic abuse. We know, as I said before, you take that newborn baby, you take a 5-year-old, you take a 10-year-old, you take an 18-year-old. All of these children know what is going on in the house, and their health and well-being is profoundly affected by this.
Thank you, Tasneem, sharing this insightful resources and information with us. Listeners, we are discussing the damaging effects of domestic violence and abuse on children and teens. And today we have Dr. Tasneem Ismailji with us. Now I think it's a time to take a break, and then we will come back soon. Don't go anywhere.
अगर आप या कोई और जिसे आप जानते हैं जो घरेलू और डोमेस्टिक वायलेंस से गुजर रहे हैं, कृपया मैत्री से संपर्क करें। मैत्री की सेवाएं बिल्कुल मुफ्त और विश्वसनीय हैं। हमारी सेवाएं हिंदी, पंजाबी, मराठी, गुजराती और अन्य दक्षिण एशियाई भाषाओं में उपलब्ध हैं। You can call us Monday to Friday 9 to 3 p.m. on 188-862-4874. For after hours, leave voicemail in your language. You can also email us at maitri, maitri@maitri.org.
Hello everyone, as I said that we are discussing the damaging effects of domestic violence and abuse with Dr. Tasneem Ismailji, and we are back again in the conversation after a short break. So Dr. Tasneem, we are talking about effects of DV on children. Now I would like to know that about this effects on teens, because I have seen that South Asian parents many times in my family or friends, we have seen that many parents they have high school teens children, and they say that my children, they don't know anything about dating, or they are not in any dating relationship, or what are you talking about? Why would even think of we shouldn't talking about dating relationship or something like that with our children? They are only in 9th grade, 10th grade, 11th grade. But personally, I believe that sometimes we don't understand that maybe our teen children, they are in some relationship, and my concern is if they know how to be safe in their dating relationship, that is more important rather to pushing our children do not have dating relationship. So what do you think? Have you seen in your career that teens, they are facing dating violence, abuse in their own life, and they are not talking about that feeling, or if they are abused by their dating partners, and they are not comfortable talking about their feelings with their parents, their family? Anything you want to share?
Yes, thank you for asking this, Nandini. The most important thing to understand that we as humans really do want intimate relationships. We do want romantic relationships. And so it's a very normal, healthy desire of us humans to want to be in a romantic relationship. And the teens is when that romantic relationships interest starts up. So if you look at it from a positive aspect, that yes, this is normal. And then if parents could indeed approach it from that kind of way, that yes, this is good, this is normal. Now, a lot of South Asians, including myself, I just went to girls' school. I even went to a girls' medical college. So I never studied with boys. I did not know how to have relationships with boys. But now the children, especially if you're raising them in the US, they go to school, they have experiences, they have the opportunity to be with maybe the other sex or the same sex or whatever it is. So as these feelings and emotions, which are normal and healthy, are developing, we as parents should support them, and we as parents should actually learn about them, that this is a good thing. And if we do indeed take it from that approach, then the teen's like, wow, my mama thinks this is good. They'll be a little bit surprised. So when I was doing practice, I was doing adolescent gynecology. So I saw many, many teens who came to me for contraception. And I would ask them, do your parents know that you're coming to see me for contraception? And some of them would say yes, and some of them would say no. Many times I would ask them, would you feel comfortable bringing your mother with you for this appointment? Some of them would say yes, and some of them would say no. And if you think about it, that one particular teenager that I remember very clearly, when I spoke to her, that my approach is that when you come for your first vaginal exam, I really encourage you to bring your mother with you for the visit. I did not have the mothers present when I was doing the exam, but I would start the conversation with the teenager. Then I would say, is it okay for your mother to be here? Then the mother would come in and we would talk about normal sexuality. We would say, how much do you know about how it is that human beings connect with each other? What is a normal, healthy, romantic relationship? And that starts the conversation. So I am also not only educating the teen, but I'm also educating the mother. I do remember one child who said, no way. Are you kidding me, doctor? My mother, I don't want her to know that I've come to you for contraception. And I told her, I said, I do not need to tell her that. You know, we have a confidential agreement between you and me. I don't need to tell her. But I just want to ask you, do you think you can? No. She was adamant. There's no way that I can have this conversation with my mother. So when they are teens, it's a little bit sometimes too late. I think these conversations should start. And when I'm in practice, I actually start these conversations just when the babies are born. That's the time to educate ourselves as parents about what is normal, healthy sexual development, what is normal, healthy relationships, because that's one of the things we don't talk about, healthy relationships. And it's better to start early. The children know, because we have to develop a comfort level with these topics, because we never talked about these things before. We never definitely talked about with our parents about these things, so they're uncomfortable. So we need to learn. And if we learn, the earlier we learn, the better it is. Because remember, when you reach that teenager stage, I don't know if you remember yourself, but what you're trying to do at that age is you're trying to separate from your parents. You're trying to become an adult. This is the transition from a child to an adult. That is the teenager stage. And at that point in time, you want to feel like you know everything. There's nothing that my parents know. And when you are in that kind of a situation, it's very hard to reach out to your parents.
Sometimes I've seen that, especially in our community, South Asian community, I think there is a barrier between parents and children, teen children, what we can talk or cannot talk. And I don't know whether, I'm not generalizing, I'm not saying that all parents, South Asian parents and children, they have a barrier between them. But many times I have noticed that many topics, we are not very open or very comfortable talking to about with our teen children. And I remember one doctor once told me that she was visiting one 15-year-old, and she that 15-year-old came because she had some shoulder dislocation, something like that. I mean, but when the doctor was examining the girl, and she found out that the girl is actually pregnant.
Yes.
And then she started, questioning and all that. And then she came to know that the 15-year-old girl actually is having a dating relationship, and the boyfriend is very abusive. And now that's the shoulder dislocation, what was the reason she came to see a doctor, actually caused by the boyfriend.
Yes.
And on top of that, she is pregnant.
Yes.
And so it's when that doctor wanted to have discussion with the parents, because it's a serious issue like the shoulder dislocation, but also the pregnancy, teen pregnancy, 15-year-old. And that girl was very, very upset, and she was very upset. She started crying, and she said, "My parents don't know anything. I told my parents that I had an accident. That's why the shoulder dislocation is, I am having this kind of accident. I have had this kind of accident. So that's why I have shoulder dislocation. I didn't talk about my boyfriend, and forget about abusive boyfriend." So I was, when I was listening this story, I felt so sad that I was thinking about that 15-year-old, that she's so helpless. She's abused by her boyfriend, going through under enormous pain, and now she's so scared that what will happen if my parents, they know about this situation. So I'm like, I don't know what to do. I mean, how to remove this barrier. I have a teenager son. I have a son who is 14 years old, 14 plus, almost 15. So I'm wondering that are we communicating enough so that he knows that whenever he is facing or any abuse or any problem in his life, and he can come to us, he can talk to us without any fear. So why do you think that in our community we see this kind of barrier between parents and children? Anything you want to share as a doctor, as a community member, as a woman, as a mother, South Asian mother?
Yes, of course. I have raised two adult. My children are adult now, and I have two grandchildren as well. So this is something that we as parents have to be very thoughtful about. We live in a very rapidly changing society. We have so much information and knowledge available to us because of the internet. And if we as parents, because I know that most parents have the best for their children in their heart, but they sometimes don't know how to go about doing that. So I think what we need to do is start the conversation, because when I listen to many, many conversations within my family, we talk about all kinds of issues, but we don't talk about healthy relationships. And that's a conversation that we need to start. So we need to really reach out to all of our friends, family, and start this conversation so that each one is starting to learn from it. It's the secrecy. It's the shame. It's the fear. These are the harmful things. And the child that you just told me, the 15-year-old, is probably more scared of the boyfriend than of the parents, and will not tell the parents because the boyfriend is keeping her very scared. That's part of the abuse. And another part of the abuse that you have to understand is that the 15-year-old is pregnant. She probably was raped by the boyfriend. And so it's not that the children are out there just wanting to have sex. That's not what it is. It's far more complicated than that. And we must not be afraid of normal sexual development. We must reach out to our children and say, yes, I don't know about these things, but I'm willing to learn. We must be open. We must have these conversations. We must openly discuss, because the more we discuss, the more comfortable we feel about these issues, and we feel comfortable, we learn more, and we open more, and the children are watching us. Wow, my mother is willing to learn. My father is willing to learn. My father, who never ever gave me a hug, is now willing to learn and give me a hug as a parent. So these are new experiences, and we need to be open to that. Because if we don't, the effects on the health and well-being of your children are very, very serious. This particular child who's pregnant with a shoulder dislocation is at very, very high risk. That is a very urgent situation. And as a doctor, what I need to do is get the permission from the teenager by expressing to her how much danger she is in, and then reach out to her and say, we really need to get your parents involved in this, because we need to make sure that you are safe. We need to talk to Maitri and get them involved. We need the advocates here. We need to have everybody who can assure this child's safety and health is taken care of.
Yeah. So this is sometimes it's sad to see this kind of news. I remember a couple of months back, there is a case on newspaper about a Punjabi family, I think in Bakersfield, and it was the baby she delivered. Her family killed that baby, and it was a big news in media that because they were thinking about family shame, family
Yes.
name, reputation, and then they killed that baby after their teenage girl delivered the baby boy. And it's so sad to read this kind of news.
Yes.
And I don't know, sometimes I feel this should be a lesson for our community members to understand our children, to be supportive to our children.
Yes.
And not to think about what people will say, what community will say, rather
Yes.
than thinking how can I support my own children, right?
Yes. Oh, absolutely. So, we have some of these ideas back from where we were born and raised. But we have to understand, if we are going to be living in the U.S., that we cannot kill a child. That is a crime.
Yeah.
That's a murder. And that will not go without being detected. Not in this country.
Yeah.
It will be detected, and you will have to go through prosecution for that. You will have to go and be accountable for murdering a child. So this is not a simple thing. This cannot be hidden. People who have these kind of mindsets, who have this kind of ideas, that I'm sorry to say, these are old ideas. These are not ideas by which one can live and thrive. These are harmful ideas, and they should be immediately given up.
Yeah. So, raising kids, raising children, it's not only a parent's responsibility. It takes a village to raise children,
Yes.
right?
Yes.
So, all teachers, schools, policymakers, doctors, community members, families, parents, all of us need to support our children when they
Yes.
are in any kind of abusive situation, or they are facing any problem in their lives. For example, like if teen suicide rate is really high,
Yes.
and but many times if you see the research, if you see the statistics, that it is increasing. And why is it increasing? Because many times I think that they don't have enough support from their families, from their school systems, and like mental health, it's a big stigma in our community. No one wants to talk about a mental health problem, right? You are a
Yes.
doctor, you know better.
Yes.
So if they're facing any problem, they don't want to admit a mental health problem. So is there any advice for for parents, for families?
Yes. The most important thing, as I said before, is to stay connected and communicating with your child. And as I talked about the adverse childhood experiences before, We know there's a very high correlation, association between how many adversities you have and suicide risk. We also know that people who have adversities also abuse substances like alcohol or other marijuana or other drugs, and that may well be related to the suicide rate as well. So again, coming back, it takes all of us, it's the doctors, it's the school, it's the friends, it's the parents, all of us together need to look after this child. And we do teach the doctors, because suicide is so common in teenagers now, that they should be screening for suicide risk. So that's one of the very strong recommendations that we are making, that all healthcare professionals should be asking about suicide in teens.
So as a mother of a teenage son, I would like to know, what are some tangible tips when approaching a conversation on relationship with my child?
So you have everyday opportunities, Nandini, to talk about healthy relationships. If you go to an event where you have your community members, you can just start the conversation about, oh, did you notice this one was having such a good conversation with the teenager? This father was speaking so nicely and gently and having fun and making jokes. But look at that other father. He was not at all either not even noticing the teenager, or not even having any conversation. So if you take those small kind of observations, those are good starting places to start this conversation about what is a healthy relationship, what is an unhealthy relationship. We need to talk respectfully with our teens. That's the first place, whether it's our teens or with any of our children. We need to start speaking using respectful language. We need to start showing our love and our caring. And that's when it doesn't happen, that's a good starting place again to say, oh, did you notice that? And then open that conversation with your teenage son, and open that conversation with your family members, with your husband, with their friends. When the friends come over, that's one of the things I used to do when my daughter was a teenager. She used to go to school over here. I'd have all of the school friends come to our house, and this is a long time ago. So I used TV programs like Gilmore Girls. Gilmore Girls was a very good TV program to talk about healthy relationships, because when you slow that TV show down, I could show where there was abuse going on. And so TV media is another really good. If you're sitting down and watching a TV program with your child, or you're watching a game, or you're watching anything, you can make these observations. Say, oh, what do you think about that? That doesn't sound right to me. What do you think about that? And then you build your case little by little. And then you start talking about it. But talking is one thing. But children learn from what you do. So you need to be very respectful with your spouse. You need to be respectful with your children. You need to be respectful with all of your family members. And then, give them opportunity, give them space to talk about, yes, different people have different views. That starts the conversation.
So having good role models in our community, in our family is very important, right?
Absolutely.
And also putting a lot of, as you were saying, that communication is the key. So we must have a good communication with our children, and to talk about, we must know what they are thinking about anything happening around them, and how we can chime in, how we can get into any type of conversation on any topic with them.
Yes. So one of the things with teens, because you have a teenage son, as soon as they come home from school, they go into their room and they shut the door. So they don't really want to talk to you. So you have to try not 5 times harder, not 10 times harder. You have to try 1,000 times harder to make that space that feels loving and comfortable. The teenager will come out from the room I used to have a little smoothie for my daughter. That sure got her out of her room, and we'd sit down, and then I'd have a cup of tea, and she would have a smoothie, and we'd start talking about her day.
Wonderful, wonderful. Tasneem, we are really thankful that you are here and sharing your personal experience, your knowledge, your expertise with our listeners.